everyone. I hope I'm audible and the visuals are also clearly broadcasting right now. So today we are going to talk about guidelines and syllabus that is presented by RCI, Rehabilitation Council of India. So I'm just waiting for a few more students, then we will begin discussion, right? Hello Neil, how are you? Hello Nancy. I will take all the queries, like many of you mentioning that what happened with those students, those individuals who completed their graduation from non-psychology background and then they pursued psychology in masters in psychology. So what will happen to those individuals and all? Hello Rajveer, hello Nikhil, hello Balansi, hello Foot Day. Okay, if you're having any doubt now, you can mention here. Hello Sanjukta, hello Preeti Pilania mentioning, sir, please address my issue. I am in Bachelor of 3 year in psychology. So the masters will be hospital specific or not, or MPhil will not work till that. What will I have to do? We will discuss about all these. Hello Simran, hello everyone. Hello Ankan, hello Nancy. Okay. So we all are aware about this particular notification, right? From last one day, from last 24 to approx 28 hours, सबके timeline में यही चल रहा है. We all are aware कि okay, this is not notification, this is guideline and syllabus that is presented by RCI. One thing I would like to mention in the beginning, that this guidelines and syllabus is there for feedback and suggestions. So what kind of points you are observing here, you are going to read here, chances are there कि ये change हो सकता है. In the future you can find कि उसमें कोई minor changes हो गए. So this is not fixed right now. But yes, this is a kind of draft. तो maximum चीजें ऐसा ही रहेगा जैसा हमारे पास है. But few changes could possible. So universities, department, hospital will give them right feedback and suggestions, and according to their feedback and suggestions, RCI will work on those, or maybe they will pass those kind of feedback and suggestions to UGC, and chances are there कि उसमें थोड़े बहुत changes हो जाएं. In this particular session, we will talk about major pointers, right? जो हम सबको जानना चाहिए. No matter you are going to pursue or you are going to become clinical psychologist or not. This is also important for those students as well, or those professional as well, जिसने अपनी practice start कर दी है. That means if any individual completed their MPhil and they are practicing right now, this is not notification, this guidelines and syllabus is important for those individual as well. That means you are bachelor student, you are master's student, you completed MPhil, you are pursuing MPhil. These particular guideline is important for all of us, right? And we have to welcome this particular guideline and syllabus because ये बहुत अच्छा guideline and syllabus है. If this thing, all these points that you are finding over here, if that will be active or that will implemented, so that is good for all the students and mental health services as well. So let's begin, right? देखते हैं क्या क्या given है यहाँ. If you are having any doubt, any query, right, you can mention in comment box. I'm just going to services as well. So let's begin. Okay. Okay, okay, fine. So I'm live on YouTube and Instagram. So let's begin. So first of all, you can find now there are 3 specific way to get license of clinical psychologist. First thing, we have to be very clear that according to this particular guideline, there will be 3 different medium to be a clinical psychologist. You will get your license. First is PG diploma, right? Second, M.Psy, मास्टर इन साइकोलॉजी, राइट, एंड थर्ड इज PsyD. सो PsyD तो पहले से भी था, PsyD एंड PG डिप्लोमा वाज देयर. हमने पहले, बहुत पहले जब न्यू एजुकेशन पॉलिसी इंप्लीमेंट हुआ था, एट दैट पर्टिकुलर टाइम आई टोल्ड कि MPhil डिसकंटिन्यू नहीं होगा, राइट. अगर MPhil डिसकंटिन्यू होता है तो लाइसेंस हम कैसे देंगे? तो या तो MPhil का हम नाम चेंज कर देंगे, बट MPhil डिसकंटिन्यू नहीं होगा. द सेम थिंग हैपेंड ओवर हियर, राइट. यू नो, वी हैव टू इमेजिन दैट दे चेंज द नेम name of MPhil and now they are going to mention M.Psy. तो यहाँ दो मास्टर्स है इन साइकोलॉजी. नाउ वी आर हैविंग टू डिफरेंट काइंड ऑफ मास्टर्स, MA in psychology, MSc in psychology and M.Psy. MSc in psychology, MA in psychology will be for other specialization and M.Psy will be only for those individual who are trying to get license of clinical psychologist. So MPhil के जगह पे, MPhil clinical psychology के जगह पे now we are having M.Psy, right? So there are three different courses: PG Diploma, M.Psy and PsyD. PG Diploma will be 1 year program if any individual taking admission, right? So in 1 year they will get PG Diploma. If they remain in that particular course for 2 years, they will get M.Psy. And individual in 4 years they will get PsyD, right? So that is doctor in psychology. Here you can see one more point I would like to mention here in the beginning, and then we will begin discussion in detail. If you are having any doubt, I will take those. Education qualification, this is really important, right? So first there are three different routes, right, to get admission in PG Diploma, in M.Psy and in PsyD. The first route is UGC recognized, right? You can find this particular point on page 4, right? On page 4 you can find UGC recognized bachelor's degree honors of 4-year duration. That means if any individual will complete bachelor degree with honors, right, that will be 8-semester program in a subject of psychology. That means bachelor degree, right, in honors with psychology, they will be eligible. There must be at least 60% marks, or maybe, right, in right recent time we can find कि जो reserve criteria में fall करता है उसके लिए कुछ, right, थोड़ी liberty like 55 or 50%, but right now they are mentioning कि if any individual having bachelor's degree in psychology, that means honors, right, with psychology, in psychology with 60%, they will be eligible. The second route mentioning UGC recognized master degree in any branch of psychology of 2-year duration after obtaining a 3-year duration bachelor's degree with psychology as one of the major core subject in the in all 3-year bachelor's degree. In a simplified manner, we can say if any individual having masters in psychology in any specialization, counseling, clinical or any other, with bachelor in psychology, right, then they will be eligible for this particular program. They can be a clinical psychologist. This was the second route. Now the third route mentioning UGC recognized master degree in any branch of psychology of 1-year duration. That means if any individual pursuing 1-year master's program, but if they are pursuing 1-year master program, they must have 4-year bachelor's degree. So 4-year bachelor's plus 1-year master, they will also be eligible. So we can sum up. सबसे पहला point है, if any individual having 4-year bachelor's program, we call them BSc or bachelor degree in psychology honors. That will be 4-year program. They will be eligible to be a clinical psychologist. They can pursue this kind of courses that we are discussing about. Second, if any individual having 2-year master's degree in psychology with 3 years bachelor degree in psychology, they will be eligible. And third route mentioning if any individual having 1-year master degree with 4-year bachelor's degree with psychology, they will be eligible for this particular, right, course. So these are the criteria, eligibility criteria. Now there are one provision that is really welcoming. There are provision of lateral entry as well, right? Suppose that if you have taken admission in PsyD, let's take an example, and after 1 year, just because of any reason you cannot continue your education, then those 1 year will not be waste, right? You will get degree or you will get, right, license of clinical psychology associate. That means you will be eligible to get right, diploma in psychology that we are discussing about, right? PG diploma in clinical psychology. If any individual completing 2 years, then they will be eligible to get M.Psy. And if individual completing 4 years, then they will be eligible to get PsyD, right? So here we can see at page 5, there are 2 specific points for lateral entry. Point A mentioning those have completed professional diploma in clinical psychology of 1 year duration, no more than 3 years prior to the admission year from RCI recognized centers in the first attempt with 65% marks in aggregate and having valid CRR and in professional practice without any disruption with no legal and professional complaints are eligible to join from year 2 and continue their education. That simply means, according to the current situation, there are professional diploma in clinical psychology. If any individual completed those, suppose that किसी के पास professional diploma in clinical psychology है, right now they are having valid license. They are also eligible to take admission directly in second year, right? If there are term and condition, if they completed their professional diploma in clinical psychology in first attempt with 65% marks, और उनके पास जो डिप्लोमा है, professional diploma in clinical psychology, that must not be right. There are one point. There are a specific timeline, right? 3 years, right? So if any individual going to take admission right now in 2024, so their professional diploma in clinical psychology not must be before 3 years. That means 21, 22, 23, right? अगर वो 23, right? Suppose that if they are going to take admission in 24, so 22, 23, 24. If they are taking admission in 25, so 23, 24, 25, we can consider this. That means 3 साल से पहले का उनके पास डिग्री नहीं होना चाहिए, right? These are the point. Second point mentioning, those have completed M.Phil Clinical Psychology of 2-year duration, no more than 3 years prior to admission year from RCI recognized center in the first attempt, both part 1 and part 2 with minimum 65% marks, they will also be eligible to take admission directly in the third year, right? That means if any individual completed their MPhil, right, 2-year MPhil, and they completed part 1, part 2 in first attempt, right, with at least 65% marks, they will be eligible, but उसका MPhil 3 साल से ज़्यादा पुराना नहीं होना चाहिए. They will be eligible for PsyD program and they can continue their PsyD directly from the third year. This particular point is really important for all those individuals who completed their MPhil and they are practicing right now. Why I am mentioning it? Just because whenever you are looking into the responsibility, what kind of responsibility professional diploma in clinical psychology will get, we call them associate clinical psychologist, psychologist and senior psychologist, or we can say those individual, right, who completed diploma in clinical psychology, M.Psy and PsyD, they all have different kind of responsibility, right? And not only responsibility, what kind of, right, what we can say, approval they are getting, what kind of work they can do, right, in academic area or in clinical setting, right, there are also difference. That means those individuals who completed their MPhil, it will be now, right, it look from outside, if they will complete their PsyD, so that will be beneficial for them, right? इस पे भी discuss करेंगे, right? Now on page 6, you can find in 3.1, right, section, that is about PG diploma. This particular section mentioning the candidates on successful completion of 1 year postgraduate diploma in clinical psychology can register with RCI as a clinical psychologist associate. That means they will get license from RCI, but they will get license of clinical psychologist associate. What it means? So there are few specific points that they are mentioning. They are saying associate clinical psychologists are not trained to offer therapeutic intervention in a special population. That means a special population को, you know, therapy or therapeutic interventions वो नहीं दे सकते. This is the first point. The second major point that they cannot do, you have to understand it very clearly, associate clinical psychologists are not trained in neuropsychological evaluations, right? So basically they are not trained in neuropsychological evaluation, so those kind of evaluation they cannot do, right? They are not trained in neuro rehabilitation or brain damage or brain lesion and or cognitively impaired, right, client. That means they will not eligible to offer right assessment to these kind of population. Next point mentioning professional, right, with PG diploma in clinical psychology with this qualification, that means with PG diploma in clinical psychology, are considered not adapt to undertake clinical research. They will not be able to participate in clinical research, either funded or not funded. Because of these reasons, associate clinical psychologists are not considered for faculty position in academic setting, and these are in need of further training. That simply means those individuals who are having clinical psychologist associate license, they will not be able to be a faculty, or they cannot present themselves, they cannot serve position of faculty in any organization, right? So these are the point. Now, second point I would like to mention what they can offer. So 3.1, that is at page 6, they are mentioning they can offer broad range of clinical psychology service activities such as assessment of intelligence, memory, personality for psychodiagnostic purposes, stress and coping style, and a variety of clinical ratings of psychiatric symptoms, syndromes. Associate diploma qualified professionals can offer a variety of routine counseling such as individual, group, family, marital, sex, and conduct psychotherapies in various settings such as hospital, organizational setting, right, clinical setting, OPD, right, and in any community, all these things, right. Next point mentioning, associate psychologist can be employed as an underfill class for existing clinical psychologist position under state and central government sector, but there are few specific things that we have to understand that I mentioned here that I would like to pointing out. However, the role in such appointment is limited for providing clinical services to client with mental illnesses and does not involve independent responsibility in academic activities such as teaching, training, guiding, supervising a student of clinical psychology at the academic departments, and independently issuing or authenticating any kind of certificate for medico-legal purposes. That means those individuals who will become clinical psychologist associate, they cannot participate in teaching activity, as well as they cannot issue any kind of certificate for medico-legal purposes. So there are certain restrictions about it, right? And clinical psychologist associate will considered as a junior consultant in organization, right? So there will be a kind of designation. They will be considered as junior consultant in those organization. Now we will discuss about M.Psy. M.Psy, that means Masters in Psychology in Clinical Psychology. Now what I want to mention here, M.Psy that we are going to discuss, that is equivalent to M.Phil. M.Phil को जो रिस्पॉन्सिबिलिटी पहले मिलती थी, M.Phil करने के बाद जो हमें लाइसेंस मिलता था, लाइसेंस के बाद जो रिस्पॉन्सिबिलिटी मिलती थी, द सेम काइंड ऑफ रिस्पॉन्सिबिलिटी, राइट, यू आर गोइंग टू फाइंड ओवर हियर under M.Psy, right? So here we can see candidate who satisfactorily complete 2-year M.Psy in clinical psychology can register with RCI as clinical psychologist under CRR and function independently as trained professional in that particular field. One thing I would like to mention here, right? If any individual completing, right, their M.Psy, right, so as I already told you, right, M.Psy is equivalent to M.Phil in clinical psychology. So there are similar kind of responsibility, similar kind of responsibility and recognition they are going to get. So it's a kind of name change, right? बहुत right कुछ ना तो syllabus में change है, and there are no such major changes, right, in their curriculum. So we can say that is a kind of name change that we can find, right? In this particular section at page 7 under M.Psy, you can find Masters Qualified Clinical Psychologist can be employed both as faculty member and as professional expert in the variety of setting, including Institute of Mental Health, medical college and hospital, community health center, school and colleges, psychosocial and neuro rehabilitation centers, child protection, etc. That means they have all specific kind of responsibility जो हमें पहले MPhil में मिलता था, all those kind of responsibility and all those kind of approval you are getting under M.Psy, right? Next point under M.Psy, they are mentioning graduates of M.Psy clinical psychology and M.Phil clinical psychology may apply for entry into year 3 of PsyD clinical psychology program if they meet the eligibility criteria. That means those individuals who completed M.Psy or those individuals who completed M.Phil in clinical psychology, they will be eligible to enter directly into third year of right PsyD. But if any individual completing their PG diploma in clinical psychology and they want to take admission in M.Psy, so they have to face entrances. If any individual completed their M.Psy in clinical psychology and they want to take admission in PsyD, then they have to participate in entrances. So entrance will be there. If you will be able to crack that entrance, so lateral entry is there. You will be able to take admission directly, right, in next year. That means if you completed diploma in clinical psychology, right, you know, a PG diploma in clinical, then you will take you will enter directly into the second year. If you completed M.Psy, then you will, right, enter directly into the third year, right? In 3.3 section, in section of PsyD clinical psychology, you can find few specific points. They can function as a senior consultant, senior researcher, senior supervisor, and trainer of clinical psychologist with CRR. That means those individuals who completed PG diploma, they will be junior consultant. Those individuals who completed their M.Psy, they will be considered as consultant or clinical psychologist. Those individuals who completed their PsyD, they will considered as senior consultant, senior researcher, senior supervisor, and trainer of, right, clinical psychologist, right? One more point I would like to mention here: PsyD qualified professional can undertake independent clinical and non-clinical research and guide PhD and PsyD candidates from the beginning of their academic professional career. That means after completion of PsyD, they can supervise PhD and PsyD candidates, and this kind of opportunity, this kind of approval, this kind of, right, what we can say, right, eligibility you are not getting after PsyD. So there are clear differences. अगर इसको sum up करें, so basically after completion of PG diploma, individual will be clinical psychologist associate, and they cannot participate in neuropsychological right, evaluations, neuro rehabilitation, or brain damage or cognitively impaired evaluations. Right, they will not be able to participate at the position of faculty in any academical setting. When we complete M.Psy or clinical psychology, individual will be able to take a case independently. They will be able to take all kind of cases, including neuropsychological evaluations, neuro rehabilitation, or brain lesion, or cognitively impaired cases. They will be able to take all these. They will be able to play responsibility at faculty position, right? But when any individual will complete PsyD, then they will be able to play all the responsibility that M.Psy can play, as well as they will also be able to guide PhD students, PhD candidates, PsyD candidates, right? They can work independently, right, in clinical and non-clinical research, and they will considered as senior consultant, senior researcher, senior supervisor, and trainer of clinical psychologist with valid license, right? Now there are one more interesting point, and then we will start taking your doubt. If you are having any doubt, you can mention here. We can begin discussion on those points. At page 8, there are one section 3.4. They are mentioning distinction among the professional, right? So if any individual completed clinical psychologist associate, if they completed PG diploma and they became clinical psychologist associate, we will consider them basic and capable professional in the setting, basic and capable professional in that particular setting. If any individual completed M.Psy, That means individual having license of clinical psychologist after master's level, they will considered as accomplished and expert in that particular setting. And if any individual completed their doctoral level, then they will considered as authoritative level. Authoritative level means they will be widely recognized as a trustworthy and authentic in their own in their own organization, as well as by external peers, for the knowledge and experience that individual with doctorate level demonstrating, right? That means there are clear differences in designation as well. After PG, diploma, basic and capable; after M.Psy, accomplished and expert; and after Psy.D, they will be authoritative level, right? So these are the difference. But as I told you in the beginning, RCI presented this guideline and syllabus as per NEP, but this is still for feedback and suggestions. So universities as well as organizations, hospital, different right kind of parties, different kind of mental health setting can give them feedback and suggestions, and chances are there कि उस feedback and suggestion के basis पे we can find minor changes in this guideline and syllabus. So you have to be ready, right, for minor changes. But you know, बड़े लेवल पे we can find कि ये जो चीजें यहाँ given है, the points that they are mentioning, right, majorly that will be implemented. But yes, minor changes are possible, so you need to be ready for minor changes, right? If you are having any doubt, any query, right, mention here. I will try to answer them out. Okay, there are common questions, right? Like Neil mentioning and Rajveer mentioning, Balan C mentioning, right? You all are mentioning. I'm just going to read one question. Like Neil mentioning, hello sir, hope you are doing well. Hello Neil. Sir, kindly address the issue for non-psychology at UG who have currently completed their masters and are MPhil aspirant like myself. Thank you. Second question that is already related, Rajvi mentioning, yes sir, kindly address the issue of students who have completed their masters in psychology but have a different background in their bachelors. Great, we'll take this. There are so many queries, right? Like Fude mentioning, sir, please in detail discuss students who have completed their bachelor's in a different branch but have a master's in psychology or currently pursuing master's in but have, okay, what about them? Okay, you know, your question is similar, right? You are trying to ask that you have completed master's in psychology but you have non-psychology graduation, so what to do now, what will be there, right? So I would like to mention one clear point according to this guideline and syllabus. If any individual completed their masters right now, if they are in second year of masters right now, you can pursue MPhil. MPhil will be valid for this year, for next year, right? But according to this particular guideline, they are clearly mentioning कि अगर if any individual want to get license of clinical psychologist, they must have graduation in psychology. Maybe honors, maybe pass, but in all these 3 years there must be psychology. So what I mean to say, what I am suggesting right now, if you are aspirant of being clinical psychologist, you have this year, you have next year, right? Just start your preparation and just take admission in MPhil. But one more thing I would like to mention, after suggestion and after feedback, there could be minor changes, right, in this guideline and syllabus that we are having from RCI. So ऐसा possible है कि 2-3 महीने के बाद कुछ change हो, but we need to be ready for the worst, right? Suppose that, right, if this will be implemented as it is that they are mentioning that will be implemented in those particular situation, if you are in second year or if you have completed your masters, you have time. And basically, you know, I am mentioning this only for those individual who are graduated in non-psychology background, जिसने ग्रेजुएशन में साइकोलॉजी पढ़ा है एंड दे कंप्लीटेड देयर मास्टर, सो पाथ विल बी रिमेन्ड ओपन, पाथ विल बी ओपन, राइट, फॉर अ longer period of time in future. After 2 years, 3, 5, 7, you can pursue, right, PG diploma in clinical psychology, M.Psy or Psy.D. But if any individual doesn't have psychology in their graduation, but they completed their masters in psychology, then this year MPhil is valid, next year MPhil is valid. So start your preparation with full potential, with full capacity, with full energy, and try to crack them out, right? Simran mentioning, I have done my masters with 80%. Oh, great. Congratulations, Simran. But my grad percentage is less than 60. Am I still eligible to do MPhil? Yes, Simran, you are eligible, right? So when you will take admission in MPhil, they will consider your master's marks, not graduation. So yes, you are eligible. Okay, so I'm trying to take right query as much as possible. Nancy mentioning, so what about those who did not have psychology in bachelor's? I think, Nancy, I suggested what it mean by this guidelines and syllabus. If any individual completed their master's, right, but psychology nahi tha in graduation, so you have this year and next year, right, you can pursue right MPhil. But as I told you, this is open for suggestion and feedback. So if RCI and UGC getting this kind of feedback, so हो सकता है minor changes हो for few years, maybe 1 or 2 years, maybe, right, there will be minor changes. But according to this guidelines and syllabus, to take, PG diploma, M.Psy and PsyD, there must be psychology in graduation and there must be psychology in their masters. Hansa mentioning, can we do another bachelor's in psychology after completing masters just to meet the criteria for PsyD or M.Psy? You can do, right? Lower degree करने का option तो हमारे पास हमेशा ही है. If any individual completed their masters, anytime they can pursue their graduation, right? So any worse situation going to happen over there, then definitely, right, those options are there. But I'm keen believer that if you are in second year or if you have completed your masters and if you will put your 100%, right, and if you will be dedicated for those entrances, you will crack those, right? So don't look behind, right? That is a kind of option that you can avail anytime, right? But if you are in second year or you have completed, right, focus on upcoming entrances and all the best, you can get MPhil. Linda mentioning, I am first year MA Psychology from IGNOU with 3-year graduation in English. I am 36. What is my route to clinical psychology? According to this guideline, I am repeating this again and again. I am repeating this just because this is not implemented. This is guidelines and syllabus, and that is open for feedback and suggestions. So there could be minor changes. But right now, MPhil is the way through you can get license of clinical psychologist. So you are in first or second year, so chances are there that if you will start doing preparation for MPhil clinical psychology, so next year you can crack those, right? So according to this guideline, what we are discussing right now, that is typically according to this guideline and syllabus. Changes could possible in future, right? So just keep this thing in mind. Hello Arju. Arju mentioning, sir, will it be better to start practicing after the MPhil or going for PsyD? Arju, that depends, right? That basically depends on individual, right? What is their aspiration, what is their desire? But according to this guideline, they are clearly, dividing responsibility of associate psychologist and senior consultant. They are clearly dividing those having PG diploma, MPhil or Psych, M.Psy, as well as PsyD. So I am suggesting that if any individual having PsyD, right, that will be good, right? But that typically depend on the need of the person. Individual can start practicing after 1 year, after 2 years, they can start their PsyD, or maybe after completion of MPhil. Many individual going for PhD and going for PsyD, so they can choose it. But that is specifically depends, right? Depends on individual, right? If individual doesn't have financial crunch, financial condition, so they can go with PsyD, because in PsyD, under PsyD, they will get posting in hospitals. In fourth year, right, they have to work in a hospital setting and all, and chances are there that they will get a scholarship during Psy.D. So if individual doesn't have financial issues and problem, and if they are open for study, so yes, definitely they can look into this option. Sankalp mentioning, sir, will NIMHANS change their eligibility based on this document? Yes, chances are very high that all organization right now, what kind of eligibility given in this, that is same अकॉर्डिंग टू करंट एमफिल. अभी भी एमफिल में एडमिशन लेने के लिए क्या चाहिए? एमफिल में एडमिशन लेने के लिए हमें मास्टर्स चाहिए. एक और ऐड हो गया कि यस, in future if any individual going to take admission in M.Psy, so masters in psychology and bachelors in psychology, पास कोर्स भी चलेगा, ऑनर्स है तो बहुत अच्छा है, राइट? दिस विल बी रूट. बट राइट नाउ, राइट, इफ एनी ऑर्गेनाइजेशन ऑफरिंग एमफिल प्रोग्राम, राइट, द सेम क्राइटेरिया, एलिजिबिलिटी क्राइटेरिया विल रिमेन देयर. एमफिल के लिए निमहांस या कोई और ऑर्गेनाइजेशन कोई क्राइटेरिया चेंज नहीं करने वाला, राइट? व्हेन दे विल इंप्लीमेंट एमसाई, देन राइट चेंजेस विल बी देयर अकॉर्डिंग टू दिस डॉक्यूमेंट, राइट? Anukriti mentioning, sir, I was thinking of taking a gap year this year and prepare for CUET PG in my third year, and my college is offering 4-year too, but it's optional. Should I do the 4th year or go with my plan? Anukriti, I'm suggesting if they are offering you 4-year program, so you can opt them. That will benefit you, right? Definitely, because you will align with new education policy. So that will be a good option. If you want to be a clinical psychologist, if any individual want to be, different kind of professional in psychology, like a researcher, or maybe, right, they are, trying to be a social psychologist, or maybe faculty in the college or university. So it is not necessary, right, कि हमें 4 year का complete कर ही लेना चाहिए. But yes, if you will align with the new education policy, that will definitely help you out in upcoming time to pursue your further education or to get job, right? That will definitely help you out. Priti mentioning, sir, I am doing bachelor's of 3 years. Which route I have to follow? Please discuss. Priti, if you have psychology in your bachelor's, then go with right masters. If your college, if your university offering you right 4th year as optional, you can choose them. If your college and university not offering 4th year, right, then complete your graduation in psychology and then right move with the right masters in psychology, and then you will be eligible for all these, right, that we are discussing right now. Hope this will help you out. If you are having any right cross question, you can mention in chat box. Silent majority, sir, our college might not offer the 4th year bridge course. That route, what route I take now? So silent majority, if your college and university not offering, complete your graduation in psychology and then take admission in masters and you will be eligible, right? But problem exist over there when individual doesn't have psychology in their graduation, then there will be problem according to right this guideline and syllabus that presented by RCI. Simran mentioning, can I pursue M.Psy in future? Yes, Simran, you can pursue if you have psychology in graduation and psychology in masters, you can pursue, right? Vijit mentioning, so those are in 1st year masters from non-psychology background in graduation. Vijit, as I told you, these are the guidelines, so minor changes you can expect. But if any individual is in 1st year, so maybe next year there will be MPhil program. So you need to be quick and you need to be ready for that entrances according to this guideline that we are having right now. So you are in 1st year, so you need to be ready from now that in 2nd year when you will become eligible, right, you have to fill the form and you have to crack the entrances, right? So you have to keep this thing in mind. The major problem is there with those individuals who are in their 1st year, right, of masters, and they doesn't have or they haven't completed their graduation in psychology. So major problem is there. But I personally believe कि ये feedback जाएगा RCI के पास. This feedback will be there, right, in UGC, and they will take action on this, right? Anukriti mentioning, yes, thank you so much for answering. Welcome, Anukriti. Anamika mentioning, sir, there are only 4 colleges in India offering Psy.D. Will more colleges start offering the Psy.D? Anamika, believe me, now in next 1 or 2 years, you can find there will be so many colleges, so many universities who will start offering Psy.D. Because if they will start offering Psy.D now, automatically they will start offering postgraduate program, they will offer M.Psy. So all the organization, all the university, all the hospital who are interested to offer M.Psy, they will definitely launch Psy.D program, right? So, okay. Raj mentioning, hello sir, in my bachelor 55, I am eligible for M.Psy. Yes, you are eligible, but after the bachelor, you have to complete masters, right? So, थोड़ा सा ध्यान रखना पड़ेगा in your masters when you will complete, right? Master in psychology, there are 60% right criteria, right? 65, sorry, 65 or 60. I have to check it now. 60% criteria is there for the graduation. So one thing, Raj, I would like to mention. There are one specific exam, right, that you can request to the organization, to the university and college, जिसमें हम marks increase करने के लिए, improve करने के लिए, we can fill the form. So if that option is available in your college or university, avail those. So according to the criteria, right, there, as they are mentioning, 60% is necessary. So in these particular situations, but one thing I would like to mention here, if your college and university offering 4th year, right, as optional, so you can get 60 if you are in college right now. If you are in 3rd year, so talk to your college and university. If they are offering, right, 4th year, you can enroll yourself in those programs, right, and you can get 60, right, could possible. But according to this guideline, right, 60% is the criteria, right. Okay, next is, sir, but in M.Psy is to be effective from 2024 academic year, right? So how is MPhil still valid for those with non-psych background? Okay, right, you have to understand कि MPhil का जो criteria है, right, that UGC continue, RCI, right, helping them to continue just because, right, पहले जो route था, that means those students who haven't completed their graduation in psychology but masters उसने psychology में किया because they are aspirant of becoming clinical psychologist, उन सब के लिए MPhil existing over there, right, 2 साल तक MPhil रहेगा. और MPhil का जो criteria पहले था, that criteria will continue, right, जब तक MPhil है. Right, when MPhil name this particular course, right, will discontinue, तो MPhil के जगह पे M.Psy तो हम इसी year से हम start कर रहे हैं. From this year M.Psy will be there and MPhil will be there, right? So when any individual will take admission in M.Psy, then those criteria that we are looking into this document, that will be valid. So MPhil के लिए same criteria इसलिए है, right, because sudden changes, right, will be problematic for those students, right, जिसने अपनी masters complete कर ली in psychology और graduation psychology में नहीं था. That's why this will remain same. Janab mentioning, sir, if I complete my MPhil with license in 2026, so I do not need to pursue M.Psy, right? Yes, definitely. If you complete your MPhil, so you will be eligible for Psy.D as well. You will take admission directly into the 3rd year of Psy.D. So M.Psy and MPhil in clinical psychology is equivalent, right? So whenever any vacancy came, so both individual will be eligible who completed their M.Psy and who completed their MPhil in clinical psychology, right? Sonali mentioning, sir, I was preparing for CUET, PG, and other entrance this year, and from non-psych background, what shall I do now? So first of all, take admission in good colleges, good organization. Basically, no one know, right, what will happen in the future, right, specifically to those students who are from non psychology background, specifically उसके साथ क्या होगा. But one thing I would like to mention again, जो मैं बहुत लंबे टाइम से mention कर रहा हूँ, this is open for feedback and suggestion. This document is open for feedback and suggestion. So all the university, colleges, hospitals, they will submit their suggestions and feedback. We also try to start a campaign for those students, right, who completed their bachelor's in other subject, not they are not from the psychology background. So we will try to reach out to different parties and all. So we will try to take those action, but right now we don't have clarity on those particular points. So what kind of planning you're having, move with that particular plan, because abhi clarity hai nahi. We are not much clear about all these points that you are mentioning, right? This answer is not so satisfactory, but this is the fact right now, right? No one can answer this particular question. You have to wait for, right, few more weeks to, right, months. Khushi mentioning, sir, I am pursuing, okay, a bachelor's. I'm in third year and my college is offering fourth year, but I want to do a master after third year. What should I do? Please tell. I want to be a clinical psychology. Khushi, you have both the options. After completion of fourth year graduation, you will be eligible, right, for right, masters again. Basically, you have to understand, if you are completing your graduation, 4-year graduation, then also you have to pursue your masters. Then you will be eligible for M.Psy. Why? Because this document clearly mentioning those individuals who completed bachelor's in psychology honors, right? Bachelor in psychology honors, like at page 4, you can find that particular point. UGC recognized bachelor's degree honors of 4-year duration, right? They will be eligible directly for, right, these programs and all. So what I am suggesting, maybe you are having BA or BSc in psychology. Maybe there will be variations in syllabus, right? Because this is the beginning phase. So we are not much sure. We don't have surety कि आगे क्या होगा. I am suggesting कि bachelor's complete करने के बाद you can take admission in right, masters in psychology, and then you will be eligible, right, for M.Psy. So I think that will be a good route. But again, this is document that is the subject to change, right? There could be certain changes. So just keep this thing in mind, right? I am suggesting you according to my own perspective. It is not necessary कि मेरा जो perspective है that will be accurate and that will be correct in all the manners, right? So take your decision by consulting your faculty member in the college, in the university, talk to your parents, and then take decision. But according to this particular suggestion, this particular, right, guideline that we are having, I think graduation के बाद you can pursue masters and then you will be eligible for M.Psy. That will be a good route for now, right? And if your college mentioning that, okay, if you will take admission in 4th year and I will give you bachelor's degree honors, right? That means this kind of degree they will give you. That means bachelor's with honors in psychology. Then you can choose the 4th year, but you have to talk to your faculty member right now. Okay, Anamika mentioning, sir, will IVHAS and RML release MPhil form? Anamika, right, I contacted few individual in RML and IVHAS. They are not sure about it, right? What I mean to say, जब तक उनका internal meeting नहीं होता, right, no one can say it, right? So we have to, wait and watch what is going to happen. But I personally feel that they will begin this particular course again, because पिछले लास्ट 1 या 2 साल में जो हुआ है ना, जस्ट ड्यू टू न्यू एजुकेशन पॉलिसी, दैट क्रिएटेड कियोस एवरीवेयर, राइट, इन ऑर्गेनाइजेशन, इन हॉस्पिटल्स, इन स्टूडेंट्स, इन कॉलेज, यूनिवर्सिटी. Just because of that reason, many organizations stop offering MPhil in clinical psychology. But now everything is clear, so chances are there that they will begin, right? Vipul mentioning, please tell about the BA program student of psychology. What about them? Vipul, I have already explained it. You can watch from beginning, so you will get the idea, right? What is the thing related to graduate student. Devamrita mentioning, so 3-year graduation with 60% and post graduation in psychology, but age is 36. Is there any age criteria for M.Psy and M.Phil? Right now, there are no such age criteria, right? So age criteria के लिए organization and university will decide, right? So NIMHANS can decide, CIP can decide, IVHAS can decide, RML can decide. So they will decide they are going to present age criteria or not, right? जैसे MPhil में भी हम देखते हैं, there are few organization जहाँ age criteria है और कुछ organization में age criteria नहीं है, right? So the same thing will be there with M.Psy. Okay, Sonali mentioning, this is the last question that I am taking just because of time crunch. I will not be able to take much, right, queries. But thank you so much for participating. This is the last question that I'm taking. Sonali mentioning to Nancy, right? Okay, fine. Okay, fine. One more question then I can take. Amy mentioning, will the admission process change for MPhil course that have already been announced? Will the admission process change for MPhil? No, right? For MPhil course, process of admission will remain same. Right, when MPhil will stop and M.Psy right will be the way, M.Psy, PG Diploma and PsyD, then all these things that we are discussing on the basis of this document, that will be implemented, right? So thank you guys, thank you so much. I know, right, just because of time crunch, बहुत questions ऐसे भी थे जिसका आंसर मैं नहीं दे पाया. But if you are having any doubt, any query, right, don't forget to mention in this comment box. You can reach us at info.upseducation@gmail.com. You have our phone number. If you don't have, you can visit our website. So if you are having any dilemma, any doubt, just drop a message to the team, just drop a message to UPS Education. Specifically, if you are doing preparation of any entrances, right, don't trap, right, in this kind of dilemma. If you are having dilemma, right, just drop that particular dilemma to the team. They will try to answer you out, but focus on your preparation, right? So thank you, Brain Dive. Thank you, Anamika. Thank you, Arju, right? Thank you so much, right? See you. Bye. Take care. Bye.